So number one question, can anxiety be managed without medications?
Yes.
Number two, do antidepressants change your personality?
Sometimes we wish it would. Usually no.
Number three, is scrolling social media for hours in a day harmful to our mental health?
Ooh, it can be.
Are supplements like magnesium, ashwagandha, adaptogens effective or worth a try for stress? Hi everyone, so I have Dr. Jonathan Terry here, and this is one of my favorite specialties. That's psychiatry. He's a board certified psychiatrist and loves to implement lifestyle interventions in his patient care and in his education as well. So he's an associate professor at California Health Sciences University. I've known him for last few years. The first time we met was the vaccination camp started for COVID-19. And this was, I'm guessing, in 2021. That was the first cohort where everyone was receiving vaccinations. So he is a pro in public health, in educating medical students, residents. That's the part of training where we are residents. That's in training physicians before we start practicing medicine. As well as he's a great educator even in the community. So Dr. Terry, welcome.
Thank you, Dr. Makhija. Really delighted for the invitation, and then thank you for the warm introduction.
Oh, absolutely. So that was more personal, but I would love to share or have you share, any of the professional experiences or certifications that you've had before our audience hears more from you.
For sure. I think one of the things to think about with psychiatry in so many communities is it's so tremendously underserved. So it's very rare to find a psychiatrist who does just one thing.
Yes.
So in my own case, I'm very fortunate, very grateful that I like to approach things from an educational perspective. And I often tell my patients and my learners that to doctor, the Latin root of that means to teach. And if I do nothing else in my work, whether it's in public health, whether it's with learners, whether it's with my patients, it's that we can learn something together. And I think that's a reason I appreciate so much this conversation.
Oh, yeah, absolutely. That reminds me, which I always emphasize with the students as well, is my math teacher in ninth grade had told me that, Chhaya, if you ever master a field or a topic, you better start becoming a student in something else that'll bring about the humility forever. And you'll always be a student, you'll always be a learner. So, Dr. Terry, we have rapid fire questions, which would be yes, no, it depends, maybe a one-liner. And if you feel like you want to deep dive in any of those rapid fire questions, we'll start with those and then we'll get into a couple of deep dive questions in regards to mental health and lifestyle interventions. You ready?
That sounds great. I wish life could be rapid fire questions in a lot of ways, right? So getting that, sometimes we have too much information, sometimes not enough, but
Yeah.
the rapid fire sounds fun.
Yes, absolutely. So number one question, can anxiety be managed without medications?
Yes.
Okay. Number two, do antidepressants change your personality?
Sometimes we wish it would. Usually no.
Okay, you heard that. Number three, is scrolling social media for hours in a day harmful to our mental health?
Ooh, it can be.
It can be. Number four, does everyone with depression need lifelong therapy?
No, unless we consider therapy our ways of growing and becoming stronger and building upon those strengths.
Okay, so that's very positive. Number five, are supplements like magnesium, ashwagandha, adaptogens effective or worth a try for stress?
They can be very effective if matched to the right person.
Okay, thank you very much. So I wanted to ask you before we get into our deep dive questions, since you answered something different for social media and does everyone with depression need lifelong therapy? So let's talk about anxiety and depression just as an incidence or prevalence, which is more now in our younger adults, even in our students, even school students, right? So what's the difference? Why is there a big incidence, or why do we see that more often now in our younger population as opposed to, say, a generation ago?
Dr. Makhija, I think it's a combination of a couple of things. One is I do think that the pressures on our young people are incredible right now. The things that they receive on social media, the ways that they can be aware of friends and family having this observation and perhaps judgment that they might not have had before. We also know that it's harder to do things with even, say, a bachelor's degree. The pressure is really on while the cost of living has gone up and the pressures are certainly there. I think the second area is that we're much more aware of it now. So in the past, perhaps someone might not have paid much attention to the feelings that they were having or that somebody else would have been having. Sometimes that's significant detriment to that person's path. Now we talk about anxiety, we talk about depression. When I go to my primary care doctor's office, before I can leave the waiting room, I'm filling out a form that's a screener for depression and anxiety, indicating how important these things are, that now they're really a part of everything that we do.
So it's both. It's the pressure that you just described, and of course, being more aware that these are conditions that need to be addressed. Either you realize it's by yourself, or your healthcare professional should be addressing it.
I think so, and
Yeah.
and that's where it becomes so important to tease out what's the normal mood fluctuations or stressors that we may have in life versus what's a more severe, say, disorder that would warrant treatment and professional help.
Mm-hmm. That's true. Yes. So that brings me to, one of our rapid fire questions was about social media, right? So the number of likes or the comparison, or this one went out for vacation somewhere here versus I'm sitting, right now for a long weekend at home. Are these triggers to lead to a disorder, you think?
There's certainly stressors, and how a person takes those stressors can be very important. And some of us are sort of naturally immune and can kind of roll with the punches, and others might get very upset if they notice that they're not performing as much as well as they would like to. There's some irony with this too, right? Because in creating this podcast and this discussion, my hope is that you're an influencer, right? And that the good education you're putting out there will go somewhere. And we do all have this platform now. But of course, we can't predict how others will respond to it, and certainly how much we weigh our own self-worth and feelings about things outside of our control.
Oh, that was beautifully said. So, how do we, before we get into the nuances of seeking the right help and when medications play a role, when someone's identifying that they're having this sense or emotional turbulence, which is unusual or excessive, be it anxiety, be it the mood changes, right? Are there certain interventions which could be done personally or as a group? These could be lifestyle interventions, these could be environmental, that you think anyone could start or take their first steps forward to prevent or to address them?
That's such an important question, Dr. Makija. So I think one of the things you hit on that was really important is that in what we use for diagnosis, in this DSM, or the Diagnostic and Statistical Manual that psychiatrists use and many other health professionals use, symptoms have to be causing enough of an issue that they're interfering with life, right? So in the course of a day, a person might have several unsettling or discouraging things happen, but it's usually not until the point when it begins to impact their social function, their relationships, their work, their school, that we start thinking about treatment in sort of the Western medicine approach, at least, of looking at it as this is where we might consider medications, therapy, supplements. Something has to be done versus just the regular ups and downs that all of us, I'm sure, experience throughout our days.
Right. So that's a good way to distinguish, right? If it's affecting my routine, my relationships, education. So that's a great differentiation, right? We know we are here versus are we here. So what's the first step? Talk to your primary care physician, talk to your family member, I hope, or a confidant. Where can they proceed after this, like an individual, him, her, whoever?
So I think everybody needs someone they can trust. And for some, it might be a professional. It might be a physician. It might be a nurse practitioner. It might be a therapist. For others, it might be a school counselor. It might be a teacher. It might be a parent or a friend. I've actually been really impressed with some of the technology approaches here, with the ways that therapy and even screeners and even AI is available to process some of these emotions. I think the main thing is that when someone is feeling something heavy and they notice that it's too much for them to carry by themselves, that's the first step, is noticing that. And the second is being able to ask for help in a way that fits the person.
So self-awareness and asking for help. Very neat. So I have, with patient experience, we encounter anxiety, depression as maybe a symptom, or which is being identified by the professional or the healthcare professional, or it's patient telling me that, I just feel very anxious. And usually I'm talking about the younger adults now. And, screening through that, trying to figure out that is it hormonal, is it endocrine related, is it anything related to, our internal medicine, differential diagnosis. And this might take a couple of visits or lab evaluation. But there's always this resistance that I find when everything else seems to be taken care of, but there is still this indwelling sense of doom, or, we are figuring out that, okay, there is this anxiety disorder or depression, and this person really needs expertise. Are there any strategies, any ways to present it in a conversation that you've seen which works better rather than making them feel, offended? That how dare do you think that I need a therapist or a psychiatrist?
It's an incredible question because you recognize we do have somewhat of a stigma when we
Correct.
tell a person you need to see a therapist or you need to see a psychiatrist. It almost sounds like a judgment. So one of the ways that I, as a psychiatrist, actually kind of navigate around that is I'm always listening to the patient, right? It's something as an osteopathic physician, as someone who works with learners in health discipline, there's a lot of ways to say if a person feels like their heart is beating fast, to help them acknowledge that when your heart's beating fast, that's uncomfortable. What can we do about that? Rather than saying it's anxiety, you need to do X, Y, and Z.
Yeah.
In the endocrine world, for example, I can appreciate, thyroid abnormalities, glycemic abnormalities are associated with mood changes and the ways that we feel. But the underlying symptoms might still be the same for things that we want to treat. Most people don't like feeling down. They don't like feeling anxious. It's very uncomfortable. And the way that I work with my patients on that is, what is this anxiety or this mood change? What is it trying to tell us? Is it saying that there's something off with your sleep? Is it saying there's something off with your nutrition? Is it saying that there's a relationship that's challenging? Or is it saying that there's some physiologic or biochemical piece that warrants further discussion?
So that as a psychiatrist, you are addressing those pieces as well. So say patient has had the entire evaluation done, that's medical evaluation, that's negative, and the clinician feels like now you need support of a therapist, or I would say a psychiatrist if there is, medication or even more of a diagnosis involved, right? Every therapist and every psychiatrist, are they, this is again not me not knowing as many, are they trained to have this as a foundation piece that we are here to observe, not judge?
I like to think so.
Yeah.
I look back to the ways that we train our first year medical students. And most of what we do is we teach them to ask questions and how to listen. Now, there are a lot of factors in many people's experience of seeking healthcare where that changes a little bit. There's time pressures and payer pressures and all these different things that sometimes give a person less time to just be with a person
Yeah.
and to just listen. One of the things that I think is really powerful as well, kind of borrowing from the last topic, is if you look at some of the most successful people, whether we're looking at pro athletes, whether we're looking at whoever you look up to, spiritual gurus, whether we're looking at Fortune 500 CEOs, they often have somebody in their corner that helps them with seeing themselves as a whole, that helps them with seeing these pieces where they might be getting stuck.
Yes, so that's like one of the anchors that we really need, rather than thinking it's a stigma or someone's judging them. Like, when there is a referral placed in, oh, okay, beautiful. So when someone's already seeing a specialist as yourself, right? And you are talking to them about their lifestyle interventions, maybe they need therapy sessions as well. And you covered that, like the whole person aspect of approaching their condition, right? Or the emotion that they're going through. When do you decide that medications would serve them as a supportive therapy rather than not including medications and let them just be, because that would be partial treatment?
Okay. So the decision of medications versus not medications, I think we need to look at kind of the continuum of presentations of how a person might show up and either ask for or require mental health assistance. So there's a portion of psychiatric treatment that involves involuntary administration of medications or things that are really intended to keep a person safe, either with themselves, safe from others, or if they're gravely disabled and can't take care of themselves. Those are all things that many of your listeners may not necessarily relate to, but I think it's important to at least establish that sometimes these things may be required as a part of, say, the standard of care and from a safety perspective. If we put that aside and look at everybody else, most mental health interventions occur in the community. They occur in primary care offices. They occur at specialist offices that are not psychiatrists. Again, remembering that there aren't that many of us. So in terms of a medication, first I want to make sure that a person is open to taking it, right? A person's perception, even if it's about their blood pressure medication or their statin for lipids, they're going to have a better response with that medication if it's something that they're open to taking. So for me, if it's somebody who really doesn't want to take medication, my job as a psychiatrist is within reason is to respect that. However, if it's somebody that's open to it and it's something where it might be helpful, I'm going to be looking for what we would call a target symptom. So for me, it's not just treating this kind of broad area of mood, depression, anxiety, but I'll be working, say, on I want to help this person with their sleep initiation, with how they go to bed at night. I want to help them with their appetite. I want to help them with their energy levels or their concentration. And then based on that, we will customize a profile that's specific to the person. That said, the body is capable of tremendous health and healing on its own. And there are many things that we can do with lifestyle, with nutrition, with exercise, with outlook and attitudes that don't require medication. And that's also not to say the medications are universally bad or universally good. It's nuanced as really any approach to treatment would be.
Yes, so beautiful. So let's just navigate through that world of lifestyle interventions that you're talking about. So sleep, definitely, yes, check mark. What are you discussing, or what has been studied? What's the evidence of certain strategies that could be implemented? And they're simple to improve these mental health conditions.
So one of my favorites is this topic that's been very well researched. It's called behavioral activation. And what behavioral activation tells us is essentially it builds on the premise that people who are depressed don't want to do things that are outside of the home. They don't want to engage in activities that require energy because they might not have the energy to do that. But we also know that if people with depression can get up and move, if they can go for a 20-minute walk 3 times a week, when we look at changes in their depression scores over a period of 4 to 6 weeks, it's very close, if not better, than antidepressants, especially for mild to moderate cases. More severe cases tend to do a little bit better with medication, but for many mild to moderate cases of depression and anxiety as well, physical activity is huge. Looking at a person's substance intake, and that includes things like caffeine, things like sugar, which I know is important in both of our these different things that are parts of our lives, certainly alcohol, but that can lead us on these kind of ups and downs of energy. It can be profound to sit with a person and address things that way and really look at how their habits are informing the ways that they feel and then the ways that they relate to their world because of how they feel.
What about, the nutrition aspect of it? Is there anything studied which is very specific for anxiety or depression, or is there something like an umbrella for all the mental health conditions?
So it's interesting. I think that the nutritional aspect overlaps a lot with what we might consider anti-inflammatory diets and also diets that tend to have a little bit more glycemic control. And you can speak to that, of course, much better than I can. In my world, what I can summarize is that when a person physically isn't feeling well, they're also not going to emotionally feel well. And when, say, they're emotionally not feeling well, it also impacts their physical fitness and aptitudes. So many of the things that we would use to treat, borrowing from one of your other discussions, say inflammatory diseases or rheumatic diseases, actually have good evidence for mood disorders as well.
Mm-hmm. Yeah, absolutely. We've had this podcast for just about, several weeks now. And I've interviewed a rheumatologist, of course, 2 rheumatologists. One was for gout, one was for rheumatoid arthritis, allergist, 2 fertility specialists, 1 gynecologist, 1 family medicine physician. And one of the common themes was avoid processed sugar. And that would help to reduce all these conditions in these areas. And I'm pretty sure, gastroenterology, cardiovascular, definitely. So if nothing else is taken home in that span of lifestyle interventions, yes, the sleep, absolutely, the activity, absolutely. But in nutrition, I feel like that sugar aspect of it has led to a lot of rise in incidences of almost every condition that we can think of in medicine, which is abnormal. So thank you for sharing. And I'm very impressed with the data that you just talked about, mild and moderate depression, like the walking and how it has reduced the scores. And this is almost daily walking, I suppose, or presume.
Right. And for somebody who's not really moving much at all,
Yeah.
every little bit can help. And of course, not all of our patients have the privilege of being able to move, right? There's factors where the main thing is engaging in activity, right? Beyond the passive activities that we do when we're stationary.
Yeah.
Don't get me wrong, I love streaming and watching movies and things, And that can be helpful, but getting up and moving and leaving the house and having social interactions are so important for most people.
Absolutely. Social interactions, the social connection. Can you just elaborate, right, on because we are in this era of computers, the AI, it's very easy to engage in a conversation with technology. And it could be very entertaining as well. So it could be screens, it could be on your Siri or Google device, it could be, talking to Chat GPT, and it's so much fun to have a conversation because they are also conversing with you. And I've had young adults tell me that the Chat GPT gets me more than what my parents do. So, we are not breaking the cycle here. We are not, against it because it can be a very good tool and a resource. Give us some ideas, some insights, how to simplify social connection because we're all, humans are social beings and you're surrounded by humans. And then we'll get into the pet world for mental health.
Yes, so many. We should plan another episode to just for this question because it's such a great one, and I think it causes us to reflect on the range of human social interactions. Right, some people thrive when they have robust and deep connections. Others, it can be a little bit exhausting, and maybe it's just the occasional connection or just with someone they trust. So I think the main thing for me is respecting the diversity in that, while also acknowledging that as primates, there really aren't any other primate species I'm aware of that operate in isolation. We and our ancestors, in many ways, we are, for the most part, social beings, and we do operate in communities. And perhaps that is one of the places where social media, some of these topics we touched on earlier, can really complicate things because, on the one hand, there is community in that. On the one hand, ChatGPT or these large language models, they do allow for conversation and connection, but it's a little bit different. It's probably, for some people that may be enough or it may be very fulfilling, but for others it really may not be. And I think that as a mental health professional, that's one of the things that I really work on with my patients, seeing how their individual needs are being met. I can guess for what'll work for 90 out of 100 people, but I also want to know for those other 10,
Yes.
where do they fit into this, and really empowering them to maybe see their blind spots and see if there is something that might feel a little bit challenging at first, but might be worth it.
How does the cognitive behavioral therapy, like, does these discussions that we are having, are these a part of CBT, or CBT would be completely differently aligned when you as a psychiatrist or healthcare professionals are addressing or using that as a tool?
So many of us in my field, we love cognitive behavioral therapy, not just because it's the right answer on many multiple choice tests that involve psychotherapy. It's something we just finished our psychiatry course at the medical school. So
Yeah.
CBT or cognitive behavioral therapy is something we speak about a lot. Now, the breakdown of that, the cognitive implies brains and cognition and thoughts, and behavior implies the things that we do. So a way to kind of simplify and summarize CBT for listeners who may not be familiar with it is that it involves a person recognizing what their thoughts are about a topic, and then recognizing how those thoughts lead to certain feelings within them, and then how those feelings lead to some type of action that either serves the person or doesn't. So I think the first step with cognitive behavioral therapy is being really comfortable with understanding what our thoughts are and how those reflect either our what's going on around us, but also our core beliefs. We have a lot of thoughts, a lot of noise throughout the day about the way we feel about ourselves, right? We might be standing in line at the grocery store and have certain reflections about how we hold ourselves in that line, or how we speak to the person, or how we interact with with the machine that helps us check out. All of those thoughts lead to the ways we feel about ourselves, about our world, and then finally to the actions for how we interact with it.
So it's being aware, and then self-reflection, right? And then what's my response versus a reaction? And then as a healthcare professional, you're guiding the patients just to recognize that path.
I think that's a big part of it.
Yeah.
Many of us have this noise on. It's almost like there's a TV on in the background, and it's just talking to us all day about all these different things and perceptions of the world, what we think of the person in the crosswalk, what we think of the driver in the car next to us. But we don't take a step back to really see, why are we thinking those things, and what sort of aspects from our upbringing, from the ways we feel about ourselves, impact and shade those thoughts that then end up impacting everything we do in our lives.
Right. Yeah. I feel like there's so much of conditioning also where we grew up or what kind of education or, people that we were surrounded with that these preconceived notions or just perceptions about certain things that are deeply ingrained. And you're helping patients to identify that or maybe just here is a mirror and just look inside. And how is once I'm just curious now with the response or how patients take this, like what's the transformation happening if you have certain patient experiences when they're going through the cognitive behavioral therapy sessions, and is there like a aha moment or oh my gosh, I did not realize that I was holding on to this, and now they've transformed in how they are perceiving life or a certain emotion or a certain stress.
Some people are really surprised.
Yeah.
And, so as a psychiatrist, and as is the case for most people who are trained in psychotherapy, we do our own therapy. We have to be comfortable with these topics in our own lives. And it can be very surprising what sort of skeletons there are in the closet, what sort of impact from earlier relationships or past relationships or the way people treated us impacts the way we treat others. And I think realizing how much is just on autopilot versus being able to take a step back and really be mindful about it and understand, okay, this is what this means to me, and this is why, and here's how I can change that.
Very beautiful. This is, this, I feel like it's also a great way of connecting within yourself, your inner core, your true personality, which is all pure. And the way you explain the CBT, I feel like whoever is listening to this or watching it, it may just feel like I am going into a room or meeting someone, a specialist, and will find myself. I mean, that's such a great way. Like I'm going for a therapy session or a CBT versus I'm going to find myself. And just a different way of looking at it. So this is how I'm going to explain to my patients now.
I love that. And finding oneself
Yes.
terrifying.
Well, I think sometimes we're all ready for it. And like you said, the skeleton in the closet, but there is support. You're not doing it yourself. It could be scary. It's definitely fearful when, we are just doing it ourselves. But when there's support, right, the therapy is happening with an expert. And what I love that you as a psychiatrist or whoever is trained in psychotherapy, they are also practicing themselves. They are qualified, but they're also experienced. And now they're sharing their experience and being there with them. So I feel like the support is going to make them stronger. Finding myself. I really love it still.
That could be our next podcast.
Yes. We're going to convert this into a philosophical and spiritual conversation soon.
I am so there for that.
But it's still connected, like mind, body, soul, and the whole person perspective. And when we're having these conversations with patients, it's not just about diabetes or sugar or, change this, don't do that. Or it is all about that connection that we all relate to eventually. So with that, I think I still have a lot of questions in my mind. And yes, I agree with the second episode. Where would you leave our audience with? Like where, in terms of, if they're struggling or if it's an emotional trauma or if it's just lifestyle interventions, just give us some words of wisdom that they can take back today.
That's a tall ask, Dr. Makhija, but I think I've got something for us.
You will.
And so this is borrowing a little bit again from the training that most mental health professionals go through. And one of the things that we would hope that most of our, depending on our discipline, our clients, our patients, so on, would think of or find in our offices is a place of non-judgment. I think that often throughout the day, so many of the people I work with who are stuck, both as patients and professionally, and my learners, the places that they get stuck are the places where they are judging themselves in a way that someone who is not them would not be judging them the same. I think that's really one of the most special things about the therapeutic relationship is going to a place where the person's not judging you. And my thing to leave the listeners with would be for what they are struggling with. Let's say they are feeling, we've talked about anxiety and depression a lot today, but let's say that they feel a certain way about themselves because they're feeling that way. My encouragement would be, one, to find support from someone you can trust with it, professional or otherwise, professional if indicated. And then two, to drop the judgment. easier said than done. But going back to CBT, the first part is recognizing those thoughts that correspond with the judgment and saying, hey, this is part of the noise I'm dealing with. And just because I had a bad conversation or a grade that I didn't like or a performance evaluation that wasn't up to snuff or, their dog looked at them weird or whatever it might be, it doesn't mean they're a bad person. And I think being able to unpack that and really remove that self-judgment, if a person can do that, that's a lot of psychotherapy right there.
Right there. Thank you. Beautiful. Thank you for being here, and I look forward to our second episode too.
Thanks so much, Dr. I really
Yeah,
appreciate it.
absolutely. Thank you, Dr. Terry.